Listen to this one. When you swallow all day long, 8 billion bacteria get swallowed. So there's two routes, one through the top of the digestive tract. That's why you can find these bugs also in the cells of leaky gut, but also through the circulatory system. We call that the superhighway of the body, right? So what's it doing in the brain? What's it doing in the carotid artery over here? And when those findings were done, people started understanding, oh, wow, the mouth is directly connected to the rest of the body, just like every part of the body.
Hello, Heal Squad. Welcome back. Glad to be back with you guys today. We have a really great guest today I'm excited about. He's going to change the way you think about your mouth, not just your smile, but your entire well-being connected to your mouth. We are very excited to welcome Dr. Jonathan Levine, one of the leading voices in oral health in dental longevity. He has over 35 years of experience. Dr. Levine's treated everybody from Lenny Kravitz to Mariska Hargitay, and he's on the cutting edge of a new wave in integrative medicine where your mouth is seen as a powerful mirror for your whole body health. He's here to break down some jaw-dropping truths about how your teeth, gums, and even your saliva can serve as biomarkers for disease risk, gut health, and even heart function. But first, our quote of the day. Oral health is the most important microbiome in the human, the one that connects everything. That is from Dr. Jonathan Levine, friends. So without further ado, let's jump into this conversation about our mouths. So welcome to the Heal Squad, first and foremost.
Thank you.
And I was scrolling through your Instagram, and something that caught my attention was how you share about our saliva being able to reveal so much about our overall health. What have you discovered through this process?
Yeah. So my background is microbiology immunology, and saliva from the last 10 years of science and research has become the new blood diagnostics. So what does that mean? What it means is that we can detect whether it is biomarkers, metabolites, proteins, viruses, COVID. How are we testing? We're testing through saliva. And so instead of drawing blood, there are many ways now through saliva detection to understand systemic health issues. Beyond that, the oral microbiome is the second largest microbiome of the body. So we all know how important the gut is and the gut-brain axis, and how, it's basically a second brain with the connectivity. Well, the mouth seeds the gut. What does that mean? Well, you have inflammation in the mouth. You have these pathogenic bacteria. There's 7 biggies. When the mouth is inflamed, in other words, the gums around the teeth are chronically inflamed, and we'll talk about it, periodontal disease, those bad bugs, it's a bacterial balancing act, those bad bugs work its way into the different organs and the systems of the body. So Alzheimer's, cognitive function, Andrea Kamer's group, NYU, 10 years old now, and it's so much research on top of it. P. gingivalis, the pathogenic #1 bad boy, bad person, bad bacteria, only 1 micron, is found in the amyloid plaque of the brain. You can find it in the heart valves of the heart, of the cardiovascular disease, carotid artery. You can find it in the pancreas of pancreatic cancer, the interstitial cells of leaky gut. 55, you name a disease. Rheumatoid arthritis, my dear friend Dana Orange, amazing researcher from Rockefeller, found the direct connectivity, causality of inflammation in the mouth, periodontal disease, and rheumatoid arthritis. Perio goes down, rheumatoid arthritis goes down. Same thing with cardiovascular disease, Moisey Devereaux's group in Colombia. I go on and on with name a disease. We can show that it's either a risk factor, because many of these diseases are many risk factors, right? We call it a constellation of risk factors. Cardiovascular disease, #1 killer in America. So on and on and on, you have this connectivity of the mouth, and the mouth seeds the gut. Listen to this one. When you swallow all day long, 8 billion bacteria get swallowed. So there's two routes, one through the top of the digestive tract. That's why you can find these bugs also in the cells of leaky gut, but also through the circulatory system. We call that the superhighway of the body, right? So what's it doing in the brain? What's it doing in the carotid artery over here? And when those findings were done, people started understanding, oh, wow, the mouth is directly connected to the rest of the body, just like every part of the body. Unfortunately, how do cancers spread? They spread through our superhighway, the circulatory system. So, it makes sense. It's just that it's historical that dentistry is separated from medicine. Dentistry should be a subdivision, a category, an aspect of medicine, but it's disconnected because of political reasons. You have to go back to 1840. It was called the Grand Rebuke. And that was interesting because a bunch of doctor dentists who were doing oral surgery said, hey, we got to create a division of dentistry. This was the first medical school in Baltimore. But back then it was a barber profession where barbers, remember the pictures of barbers taking out teeth and the guy is screaming like, the late 1800s. Well, they said, well, you're a barber profession. Get out of here and open up your own school. Absolutely true story. Horace
I
Hayden.
didn't know that barbers were pulling teeth.
Well, yeah, it was a new dentist. I mean, medicine was so new that nobody wore gloves. There was no such thing as sterilization. It was like the wild, wild west for all of medicine and dentistry. But in addition to doctors taking out some teeth, being oral surgeons, barbers who had a chair, and all I had to do was a pair of forceps. Yeah, imagine. So they said, get out of here. Go open up your own school. And these guys, Horace Hayden and a guy named Chapman, went up to New York, raised the money, and they opened up the first dental school right near the medical school in Baltimore. So from then, dentistry is always disconnected. There's one dental school in the country that has dentistry part of the medical school, and that is Harvard University. Bum, bum, bum. In Europe, you were a doctor first, MD, and then you specialized in dentistry, which actually makes a lot of sense. I personally went to Goldman School, BU. I was in medical school for the first 2 years, and then I went on to the dental school. And then everybody in my class, small group, under 40 people, ended up specializing. We're all specialized in dentistry. So
what was it about dentistry that made you want to go into that?
It was the process of elimination for me. I was a lacrosse player from Cornell. I was doing research in multiple sclerosis as a microbiology major. I thought I didn't like business because I grew up around a dinner table that my father was in a business called the fur business. Now, you're Greek, aren't you?
Mm-hmm.
Jewish. The Greeks and the Jews were the furriers. Actually, the Jewish people first, and then the Greeks came in because my dad had lots of pals. But it was a crazy business, disorganized. Everybody owed each other money. It was always like fighting. And so I remember as a young kid hearing all of this, and I said, "Oh my God, I'm not going into business. It's crazy." So I kind of oriented myself to the sciences, and then I ended up, I was at Cornell playing lacrosse and in academics, and I didn't think. I didn't have a great experience in hospitals. I had grandparents that were very close with passed away. So, and I was working with my hands. I thought, well, dentistry could be interesting. So I go into this dentistry profession. It's completely fragmented. It's very solo climbers. It's not collaborative really. And I've been trying to reinvent it for 35 years. I've started multiple companies and foundation. And today I'm actually starting to move the needle in this with other collaborators in a lot of these different areas. I'm working on a project called DMI, Dental Medical Integration, that combines dentistry and medicine. And that's why I started Smile House, because we're figuring out how do we really do this at the point of care? How do we use new technology so people can sleep better? How do people understand their microbiome? Because now they're going to learn how it seeds the gut and how inflammation in the mouth impacts your overall health. And that's what we're doing at Smile House. And that's what I'm looking to bring out to the profession with a group of us. Yeah.
Wow. So you're right. I mean, dental has been completely on an island of its own. And it really has just been about get your teeth cleaning. And then when you need a cavity filled or a root canal, you go to the dentist. But what you're saying is, I mean, if what we've been hearing in the last few years, at least, is the mind, not the mind, but the gut brain connection. And so all of that is in here, here and here.
Exactly.
So it makes sense that you would try to integrate the two. And I think it's kind of cool. I wonder what is kind of your hope from that. Is it DMI that you said it was called?
My hope is that dentistry and oral health can be the tip of the spear of diagnostics for overall health. So what I mean by that is, if you understand what's going on in healthcare today, we're in a sickness model. People go run to the hospital when they already have diabetes, cardiovascular disease. 70% of this country is pre-diabetic and diabetic, as you know. 50, 60% obesity. So we're not doing such a great job at people understanding nutrition and how we deal with correcting the environment that we put our bodies under. We only got one of them, as you know. We want to go upstream. How do we get to a wellness model? And I really believe, look, people go to the dentist more than they go to their primary care physician. Fact. People will go to the dentist even twice a year. There's such an opportunity for us to use new technology and the rock stars of the dental practices, which is the hygienist. I'm sure you think about your own experience. The hygienist, they can explain things, they go over things, and we have some new technology that will allow us to get to certain things early. So I'll give you, for instance, we have a CAT scan in dentistry now. 25% of the specialists have it in their offices in the country. It tells us from the top of the nose, so we can diagnose nasal problems, all the way down to the airway. We can diagnose sleep issues because most sleep issues are structural, either an obstruction in the nose, so your mouth breathing, either small jaws because of growth and development, and that's a whole nother story, or airway, and also the palatal tissues as we age goes down into our throat. Snoring, sleep apnea, some type of sleeping disorder. About 40 million Americans have it today. And it happens especially as we age. The answer that medicine has is not a great one, called a CPAP. So when dentistry starts working with medicine, we could really help move the needle. Again, the oral microbiome is so critical to understand what's going on in the body. And there's all of these now, these kind of interesting new tests. DMI, dental medical integration, what we're looking to do, and I'm working with Henry Schein, which is the largest dental company, and this is kind of hot off the press, but you'll have a cleaning and we'll be able to detect about 40 biomarkers just by a little finger prick while you're having your cleaning that will go on to a patient portal. And so I'm saying this because it's right around the corner. These type of breakthroughs, because of our new technologies, is going to allow us to connect the dots of dentistry and medicine and get early and more into this wellness model so that we're not spending kind of trillions of dollars on this healthcare system. I mean, we're 20% of our country's GDP right now as healthcare spend. That doesn't work. That has to
Yeah.
get improved. Yeah.
Well, also, if you guys are able to do these tests in office and connect it so that the primary care physician is able to see this, because they're running general blood work. This sounds like an elevated test that they're not even offering that now can give them more information to help prevent, really
It's
scary
it's
stuff.
it's a lot of that, but what we learned is we want to give them tests that they understand. Because we were looking at running down that road, our group, and we realized that if they could see blood lipids, if they can see C-reactive protein, which is a great biomarker for inflammation in the mouth, if they can to detect, understand, hey, person has an elevated A1C, let's go test them for either pre-diabetic or diabetic. All of a sudden, now they have the information that they'll do further tests.
You can get
So
an
that's
accurate A1C from
oh,
saliva.
a hundred, well, 100% on the finger prick because that's blood.
Oh, got it, got
So
it. But a finger prick, so we're talking Elizabeth, what's her name now?
we're not going to go there, but there are machines today. I mean, she was boiling the ocean with BS. But the
Yeah.
truth is, there are a couple of machines. They're not expensive. That's going to allow us to have these biomarkers just on a little bit of blood, and you don't have to go too far. It is
Well, I love
absolutely.
that because we've had the medical medium on the show, and he talked about the excess blood that they take from us without our permission to run lots of tests and studies on. And so, and he talked about how hard it is to replenish that blood, even though doctors say you replenish it really easily. I guess it isn't as easy to replenish. So if you're able to do it from a finger prick, that is so ideal. And also, again, like I said, if you're doing it while you're at the dentist, twice a year, a little finger prick and a saliva test, that's amazing.
That's amazing, and people would opt into it or not. And say, well, we can, and we're going to put it on a patient portal. They share it with their doctor. You don't have a doctor? Here's a group that we work with. So this is new, but this is one of the examples. And then when we look at the oral microbiome and salivary testing, we can detect, look, the mouth has 600 species of bacteria, 8 billion bacteria. And when you're throwing off that homeostatic balance because the environment's not great, people's home care is not great, they're eating and drinking foods that are low pH, so you get into an acid environment, the bad bacteria thrive. And so that's the key to really drive health of the mouth, which will then lead to overall health. That's the thesis by which we're operating at Smile House. And what I'd like to see, to go back to that wonderful question you asked, is I'd love to see that impact the rest of the profession and people's overall health.
Wow. We're going to take a quick moment to shout out our biggest supporter of the show. You all know that I'm obsessed with linen and cotton sheets, not only because it's a great fabric, but it's the best for our health. Whether you're thinking healing frequencies, it also is temperature controlled. I even traveled here to this movie set that I'm shooting a film at with my own 100% cotton sheets that I got at Macy's. And right now is the perfect time to buy it because Macy's big home sale is going on now. You can get 40% off linen sheets and amazing brands that they have, not just bedroom must-haves, everything you need for your home upgrade, from all-clad 7-piece stainless steel cookware sets or Shark vacuums. All the amazing deals that you want, you can get up to 40% off. I've linked some of the items that I'm picking in my wish list below so you guys can see and get your inspo on. Don't forget, Macy's Big Home Sale is going on now until August 13th in store or online at Macy's.com. Happy shopping, friends. I love that. The one thing I will say I am scared of is the CT scan because we know how much radiation CT scans carry. And one of the things that I don't like when I go to the dentist, just being honest, is they always want to get an x-ray. And I'm like,
Yes.
why do we need all that radiation twice a year? And by the way, I love my dentist. I know
Yeah.
it's just like any other profession. There's just a standard that's been created that everybody follows. But that's a lot of radiation. And I don't think it's really necessary unless you have an issue, if you have a pain or something like that, or maybe every so often. I just say no to all of it at this point. But what is your take on all of
Let,
that?
let me give you some facts. A full series of x-rays, about 16 x-rays. Now we're using all ultra high speed and low radiation x-rays. What's interesting about computerized tomography, it's a cone beam, CBCT, it's equivalent to about 6 dental x-rays. When you take that, which takes 9 seconds, and there's 10 different companies out with them, you see, and it's good for 5 years, you see from the top of the nose. So we see nasal, we see joint jaws, we can see all of the bone, we can see if there's any infections in the jaw. We also see what's called a panorex. We also see the airway. Okay, we get a tremendous amount of information where we can make a referral to the ENT, and we can work with our medical colleagues to improve the health of the people because they can now get into deep regenerative sleep. From an x-ray perspective, you can take these bite wing x-rays, and if somebody does not have a history of decay, then you can do that every couple of years. Look, you're talking about x-ray radiation. You go across the country from New York to LA, you're getting a lot of radiation. But your point is well taken. So what's going to happen over time is the diagnostics are going to get better and better from the amount of joules, this radiation that people, are getting exposed to. So it's a great point. And I think our research that drives our technology is going to answer the call here. So what's very exciting in dentistry is we see so much more than we've ever seen before. We can work tighter with our specialists, all of us who place implants, do reconstructions, detect lesions, root canals that are failing, lesions from an old root canal that's causing issues. All these things can be detected because if you can't see it, that's when you're in trouble. If you can't get early on these things, that's when they become a much bigger deal, as you know.
Good point. The The brain tumor thing is interesting because most women, meningiomas are very common in women. I'm sure you know that. And you usually only detect them after an accident. So I'd be curious if you have intercepted brain tumors along this journey from this new scan that you have.
Yeah, so we make a very tight field because of what that question you asked about radiation. So we don't look that high up. The only thing that we're really looking at is top of the nose. And we're working now with some very integrated medicine groups. So, they're doing all of kind of their work. So we want to be additive to them. So nothing there, but I can't tell you how much nasal obstruction, because the issue with mouth breathing. Mouth breathing really doesn't allow us to get into deep regenerative sleep. And all you have to do is wear an Oura Ring or a Whoop or an Apple Watch and really understand sleep to know how important it is to be able to oxygenate your body. And if you don't, it leads to cardiovascular disease, hypertension. You're not getting rid of all of these, environmental toxins that are happening, oxidative stresses during our day and where we live. So it is critically important that people get into deep sleep. And as we age, it gets worse. And a lot of people, either they don't do anything about it or they wait too long. And then all of a sudden, the medical profession, with all due respect to the CPAP that blows air down your throat, is not a great option. There's better options today.
Yeah, so if you are a mouth breather and you see them in your practice, what's the solution for that?
Yeah, exactly. So we diagnose. It could either be a central nervous system issue where we then make the referral to the doctor, the MDs, and the MDs are working collaboratively with us with sleep tests. So we get a sleep test where you know exactly what's going on. Most of the sleep issues are structural. In other words, there's an obstruction. So what does that mean? That means there's either a nasal obstruction, the jaws are small, or there's an obstruction in the airway. Through
Like
our
a
CBC,
tumor or something?
no, it's anatomical. So I'll give you, for instance, people now have, whether it's in the growth and development, your child is 4, 5, 6 years old, the jaws are getting developed. If they're mouth breathing and they have nasal obstructions, those jaws are developing very small. When the jaw is very small, and you'll find this interesting, the tongue falls back. It's like the tongue is living in a studio apartment instead of a penthouse. The tongue has to actually live in a much bigger area. The jaws have to be nice, big, and wide. You go back 400 or 500 years, it's these great studies that were done by these researchers. Corricini is one of them. And they found that 400 or 500 years ago, when they looked at those skulls, there was no need for orthodontics. There was no need for taking out wisdom teeth because the jaws developed so nicely. So what was going on then that is now going on now? And what's going on is that people have a modern diet, eating soft foods in growth and development, more environmental toxins. So you have rhinitis and nasal obstruction, and all of a sudden people are breathing through the mouth. What does that do? It builds a jaw profile. We call it dolichocephalic, but long face. And the young people are breathing through the mouth, which creates a narrow vault, which doesn't allow the tongue to come forward. So what we do, there's myofunctional therapy where the tongue is developed. There's kind of exercises to move the tongue, but we actually expand. So, the young children, they have all these kind of appliances. We're now expanding Frankel appliances and these expansion of the upper jaw. So instead of taking out teeth, as they did 20 years ago in orthodontics, which create small jaws, they expanded everything if the young children develop that way. If the young mothers know what they need to know about nasal obstruction and harder foods in their modern diet, these jaws will develop beautifully. So that's an example that it becomes structural. When we take a CBCT, we could see the diameter of that airway. Some people, when you got over 120 square millimeters of an airway, you're good. But a lot of people are breathing through a straw. So if you come to the office and you see a CBCT and you have 27 as a number, I could tell you're waking up during the night. You have some type of restricted type of breathing. And that doesn't allow you to get into deep sleep. So basically, all of this new information, because we have a CBCT and our knowledge is so much more, is allowing us to diagnose. And the key is to work with our medical colleagues and come up with a plan. In dentistry, what we do is we expand the jaws. Even with adults, we're able to do it through a couple of different techniques. And we also can move the lower jaw forward with appliances. They're called mandibular advancement devices. So there's nice technologies that we have in dentistry once we can diagnose with our medical colleagues to improve sleep.
Wow.
Yeah.
Yeah, I caught my daughter mouth breathing at dinner the other night. She fell asleep, and I was like, do I need to be worried? And she doesn't do it all the time, but I did catch her, and I was like, oh
Yeah.
no.
Yeah. Yeah. She might have had a cold, little rhinitis, and sinusitis. And that's where, you just got to know to be on it.
Yeah.
And they start leaning forward, and because they're breathing through the mouth, and it's like a wind tunnel. When you breathe through the mouth was not designed for breathing. The nose is designed for breathing. And we have all these abilities to, defend ourselves through the nose and the filter. The mouth is the top of the digestive tract, built to break down foods with our, our amylase and our enzymes. It's just not designed for that. And so the anatomical form that develops in young people is what's going to hurt us later in life. And this information is only 10 years old tops. So Sandra Kahn, Paul Ehrlich, they wrote a book called Jaws, fantastic book. The book Breathe, that was done by James Nestor, another great book to build awareness for these young moms and even for adults that you can get ahead of this by understanding how to be preventative. And then there's also the ways to treat it.
I would love to also talk about the health of teeth specifically, like remineralization to prevent cavities. Is that really a thing? I've just been hearing about that recently.
Yeah.
And I want to get into root canals, of course, too, and so many other things.
Yeah. So when it comes to oral health, so the whole thing is the balancing act in the mouth, right? Good versus bad bacteria. What impacts the balancing act is the environment we put our body under, just like what we do with our overall health. Why do people now understand for longevity that it's all about our nutrition, our fitness, how we sleep, and of course the motion and how we deal with stress, right? We think about these tools of longevity. Well, in the mouth, the same rules apply. If you're under stress and you're not sleeping well and you're not eating properly and you're eating or you're drinking drinks with low pH, acidic, those are drinks with very acidic, high sugar content, you're going to create an environment for the bad bacteria, like the ones that cause demineralization, decay, and also gum disease. The gram-negative anaerobic bacteria, the bacteria that cause inflammation, live in a low pH environment. When it comes to the hard tooth, the enamel, which is the hardest structure in the human body, that thing can break down. Now, in the mouth, you can have either remineralizing the teeth, which happens naturally. In our saliva, it's very protective. And what it does is it buffers the mouth. But what happens when you drink too much soda or something low pH? Also, all protein foods are acidifying, they're lower pH. That's why you need a 60-40 balance between alkalinizing food, fruits and vegetables, just like mom always told us, versus the foods that are more protein and acidifying, like fish and meat. Doesn't mean not to eat it, but you got to balance it with a great amount of alkalinizing food. Same thing with sugary and acidic drinks. Don't drink them. Drink water, get them out of your diet. So as you have this low pH type of environment, the demineralization of the enamel happens and the saliva can't protect you if you're doing it constantly and you're doing it chronically. Demin means that the enamel breaks down. Once the enamel breaks down, you're getting into this acidic environment. Sugar, which is also one of the big enemies of the body, sugar will now get to work where it's a substrate that breaks down from these bacteria that live in this low pH environment to cause what? Acid. Acid breaks down the teeth, and that's decay. So what do we need to do? We need to raise the pH, but we need to have great home care because remember, it's a balancing act. The mouth, just like the gut, is also all about having a diversified microbiome. So that means the bacteria, you have the good guys, and you got the guys that are pathogens. You don't want to wipe out the pathogens. You just need a balance between the good guys. We call them commensals. And so it's very important to detect the salivary microbiome. So just like we look at the gut microbiome, what bacteria is there, what is causing potentially a problem, a pseudomembranous colitis and a leaky gut, just like that in the mouth. If you have inflammation in the mouth, what we do at our offices at Smile House is that we do oral microbiome testing because we want to know what pathogenic bacteria might you have, because there are so many things we can do to eliminate them. So the remin process has everything to do with pH and the environment that we're putting our mouth under.
Wow. I have so much I want to get into, but friends, we're going to pause right here. Tomorrow, Dr. Levine's going to be back. He's going to be breaking down some mind-blowing connections between your oral health and things like gut issues, like we've been talking about, brain function, hormones, fertility, even chronic disease. Until then, friends, be nice people, make good choices, and be present. Hey, Heal Squad. We have been on quite the journey together, and we're hearing from so many of you just how much this show is helping you heal and get better, and it makes us feel so good. We love, love, love it, and we just ask that you don't keep it to yourself. Spread the message and share the show or your favorite episode with your friends. And if you want to help us even more, you can leave us a 5-star rating and a comment on Apple Podcasts or Spotify, and follow us on Instagram at Heal Squad. You can also DM us anytime because we love connecting with you. And finally, you can also join us on Patreon for our monthly live heal events with world-class healers and ad-free episodes exclusive only to Patreon and our Super Heal Squad for as little as $10 a month. So go to patreon.com/Heal Squad to join. Getting better isn't easy, friends, but as I say all the time, it's a whole lot easier if we can do it together. We love you all so much, and we love doing this thing called life with you.
This podcast and all related content published or distributed by or on behalf of Maria Menounos or MariaMenounos.com is for informational purposes only and may include information that is general in nature and that is not specific to you. Any information or opinions expressed or contained herein are not intended to serve as or replace medical advice, nor to diagnose, prescribe, or treat any disease, condition, illness, or injury, and you should consult the healthcare professional of your choice regarding all matters concerning your health, including before beginning any exercise, weight loss, or healthcare program. If you have or suspect you may have a healthcare emergency, please contact a qualified healthcare professional for treatment. Any information or opinions provided by a guest expert or host featured within website or on company's podcast are their own, not those of Maria Menounos or the company. Accordingly, Maria Menounos and the company cannot be responsible for any results or consequences or actions you may take based on information or opinions.